Responsible Restart Ohio for hair salons, day spas, nail salons, barbershops, tanning facilities, tattoo services, and body piercings. Mandatory practices for employees are as follows. Ensure minimum of 6 feet between employees. If not possible, install barriers. Social distancing will apply with exception that the distance between the client and employee may be less than 6 feet. Businesses must allow all customers, patrons, visitors, contractors, vendors, or similar individuals to use facial coverings, except for specifically documenting legal, life, health, or safety considerations and limited documented security considerations. Businesses must require all employees to wear facial coverings except for one of the following reasons. Facial coverings in the work setting are prohibited by law or regulation. Facial coverings are in violation of documented industry standards. Facial coverings are not advisable for health reasons. Facial coverings are in violation of the business documented safety practices. Facial coverings are not required when the employee works alone in an assigned work area. Or there is a functional or practical reason for an employee not to wear a facial covering in the workplace. Businesses must provide written justification to local health officials upon request, explaining why an employee is not required to wear a facial covering in the workplace. At minimum, facial coverings or masks should be cloth or fabric and cover an individual's nose, mouth, and chin. Employees must perform daily symptom assessment. Require employees to stay home if symptomatic. Require regular hand washing by employees. Place hand sanitizers in high contact locations. Clean high-touch items after each use, such as carts and baskets. Wear gloves and dispose of gloves in between tasks in accordance with Centers for Disease Control and Prevention. Glove removal guidance. If gloves cannot be worn, wash hands in between tasks in accordance with the CDC hand washing guidance. Dispose of single-use materials between clients. Maintain accurate appointment and walk-in records, including date and time of service, name of client, and contact information to assist in contact tracing. Oral and nose piercings are permitted provided the body piercer or employee wears a mask in combination with a face shield or protective eyewear. Protective eyewear, such as safety glasses, trauma glasses, is eyewear without gaps between glasses and the face to protect from splashes and sprays. Mandatory practices for customers and guests are as follows. Ensure minimum of 6 feet between customers. Social distancing will apply with exception that the distance between the client and employee may be less than 6 feet. Specify hours for at-risk populations, such as the elderly. Place hand sanitizers in high contact locations. Ask customers and guests not to enter if symptomatic. Stagger entry of customers and guests. Only clients will be allowed in the establishment for their service, unless client must be accompanied by a caregiver. Due to the ongoing risk of respiratory droplet transmission, clients receiving oral or nose piercings are required to wear a mask or facial covering before and after the piercing is performed. Mandatory procedures for physical spaces are as follows. Ensure a minimum of 6 feet between people. If not possible, install barriers. Social distancing will apply with exception that the distance between the client and employee may be less than 6 feet. Post social distancing signage and disinfect high-contact surfaces hourly. Clean merchandise before stocking if possible. Establish maximum capacity. Discontinue all self-service refreshments. Discontinue client use of product testers. Switch to employee only product handling. Clean chairs and equipment before and after each use. Discard magazines and other non-essential items in the waiting area that cannot be disinfected. Mandatory procedures for confirmed cases are as follows. Immediately isolate and seek medical care for any individual who develops symptoms while at work. Contact the local health department about suspected cases or exposures. Shut down area for deep sanitation if possible. Recommended best practices for employees. Group employees by shift to reduce exposure. Wear eye protection when providing services in close proximity to client when possible. Launder work clothing daily and shower immediately upon returning home from the establishment. Best practices for customers and guests. Consider having customers wear face coverings at all times. Health questionnaire for symptoms at entry point. Provide face coverings upon entry. Where possible, accept customers by appointment only. Increase availability for curbside pickup. Consider suspending return policies. Schedule appointments with adequate time in between appointments to reduce the number of clients in the establishment. Ask clients to wait outside of their vehicle or, if not possible, at the entrance of the business with at least 6 feet between clients until their scheduled appointment. Recommended best practices for physical spaces. Close once a week for deep cleaning. Maximum available checkout spaces to provide social distancing. For example, space customer lines with floor markers. Use alternate registers. Use contactless payments where possible. Increase capacity for delivery and curbside pickup. Post visible and appropriate signage to communicate to the client that thorough sanitation procedures are in place and that services will not be provided to clients exhibiting symptoms of COVID-19. Signage to be created in consultation with the Ohio Department of Health and distributed to licensees by the Cosmetology and Barber Board. Recommended best practices for confirmed cases. Work with local health department to identify potentially infected or exposed individuals to help facilitate effective contact tracing and notifications. Once testing is readily available, test all suspected infections or exposures. Following testing, contact local health department to initiate appropriate care and tracing.